Well, when I heard you at Rotary, I was blown away. And I think it's fair to say not all doctors are gregarious, especially surgeons. They kind of have a mechanics mentality in my observation of fellow humans. And nothing wrong with that. They're just more insular, I think, that don't tend to be as outgoing. So that blew me away when I first met you. And then the story of talking about, we don't have a lot of time here today in this forum, about Marcus Welby is dead. And that kind of leads into my next question. Is there a difference today in the medical profession than in previous generations? I mean, you came in several decades ago to now, and that's both culturally, professionally, medically. How has it changed?
Yeah, I tell you, Kurt, in 1980 was when I graduated from medical school. Most physicians were in private practice. You had independent guys, a surgeon maybe by themselves, or you had 2 or 3 people. Internists, the same kind of thing. Now what we're seeing is more and more physicians are part of a either multi-specialty group or employed by hospital chains. So that's a significant change for that. The thing that drove a lot of this was just the cost of practicing alone, the cost of some of the electronic health records, which we all have to have, physicians binding together, so call coverage makes it a little bit easier as far as that, and also the collegial discourse that people can have when they're together. It has good points and bad points about it. I think it's probably going to reverse itself back to getting more doctors into some independent practices, or at least smaller groups. And in fact, you see this in a trend called concierge medicine, where a person may have a doctor, you pay them a fee, and they're there for you the whole time. So,
and of course, not everyone in the population has that luxury, if you will, to be able to do that.
No, and that's exactly correct. Because, again, we've talked before about how Marcus Welby is dead.
Right.
And that idea of having that, and now all of a sudden you have to pay extra in order to get that Marcus Welby thing. Well, let's face it. If you go back to the old TV show Cheers, the tagline was, where everybody knows your name.
Right.
I think that's the thing we all want. We want to go to a place where we don't have to keep reintroducing ourselves to our healthcare provider. We want them to know us, know our family, and it just makes the whole experience much better.